My name is Jeremy from New Horizon Fitness Center, and today I'm going to be talking to you about how exercise can help with your recovery from an injury. So the first thing we need to figure out is how severe the injury is. So if you do have a severe injury, it doesn't mean you need to completely stop moving and stop exercising. Of course, unless you're told that you don't need to do anything by a doctor. Now, let's say that that injury is an injury to your shoulder. You have a severe injury to your shoulder, you're not supposed to move that shoulder at all. So in this case, it is still beneficial to attempt to exercise as long as it doesn't affect the area, such as doing lower body exercises that won't affect anything with that shoulder. To help increase blood flow and get nutrients going throughout your body, which will help in the recovery in the long run. Also, another thing that's been shown to help is actually working the opposite side of the body. So if your left side is messed up, you can always work the right side. And by doing this, science has shown and testing has shown that it actually helps maintain the strength and reduce atrophy in the side that is injured, because of our body's innate want to keep balanced. So on the other side of that, if you do have an injury but it's not severe, it's not so severe that surgery needs to be done or something like that, it can kind of be recovered through therapy and different things like that. That means there is no recovery through therapy without exercise. So what you should still be doing is attempting to move the joint or adjusting exercises so that you're able to do them without extreme pain. It obviously needs to be within your tolerable limits, but by doing that, by actually exercising, moving the joint, using the muscles, it actually helps express some of the inflammation in the area, and it also brings a rush of blood and nutrients to the area to help with recovery, as well as breaking up scar tissue so that you don't have any kind of lockup later on. And this can be done just like a couple common ideas you could do is, if it is a lower body exercise or a lower body injury, you could always, instead of doing a full squat or lunges or something like that, is attempting to do smaller movements, smaller range of motion exercises with no weight, such as maybe like a small step up, or a heel touch, or even a partial squat, where you're only making a small movement within a range of motion that's tolerable for the joint. Or even if you're looking at an upper body injury, like we were saying, in the shoulder, you could always do something either with bands, depending on the severity of the injury, or even like a table glide exercise using either just your arm sliding across it or using something like a foam roller. And these are things you can do, whether you have a severe injury or a minor injury, to help you continue with recovery and continue with your exercise to help with your total body health as you kind of work through your injury. So thank you for watching, and be on the lookout for another video that we're actually going to do that's going to be over a couple small common exercises that you can do to help in your recovery from that injury. Thank you.